Hello, everyone. My name is Luca Segantini. I'm the ESOT Chief Executive and very happy to welcome you here on this webinar on the uncertainty of living in this very difficult time with the COVID epidemics. We have a stellar panel of chairs and speakers, which I will introduce in a moment. But my task is just to give you a very quick overview of how this webinar will work. Since we have several hundreds of participants registered who are joining as we speak, everyone is on mute, so you will not be able to intervene and contribute to the webinar as we go, because that would be too challenging. But there will be a very nice Q&A session at the end. After every speaker has given the short presentation, you will be able to submit questions and interact with the speakers. This can happen in two ways. You can either raise your hand by using the button that you have in your GoToWebinar interface, and the moderators will see the raised hand near your name and will give you the chance to ask your question by unmuting your microphone and letting you know, okay? Or you can simply type your question by using the questions button, and you please be short, don't write a very long question. And if possible, also indicate for what speaker your question, by what speaker your question should be answered, okay? We'll try to keep the time, and without any other delay, I'm going to introduce Anna Forsberg and Peter Karstedt, both from Sweden, who are our chairs for today. Thank you.
Good afternoon and good evening, everybody. Thank you all for finding time and joining today's webinar. I'm from Sweden and I'm a nurse. I'm a transplant nurse since 25 years, and I'm also the chair of ETAP, which is a part of European Society of Organ Transplantation, and we organize nurses and allied health professionals all around Europe. The aim of this webinar is to create a solid platform where patients and professionals can interact and share both experiences and hopefully solutions in a distressing time that we are in. And I will now hand over to Peter, who will also introduce himself.
Yes, good evening. My name is Peter Karstedt, and I'm also from Sweden, and I received a new kidney some 10 years ago, and I've had a chronic kidney disease for 20 years, and I am the founder of a Swedish NGO called Mod mer organdonation, which is advocating for that nobody should die on the waiting list here in Sweden. And I'm also very happy that so many of you have joined us this evening. And I would like to briefly introduce the program to all of you. We will have two main parts of the webinar, and it's first and foremost the patient representatives will talk about the concerns and expectations that we have from our perspective during these times of uncertainties. And during that time, we will talk to Fiona Loud from the UK, from the Kidney Care Organization, from Mario Lefton from the Finnish Kidney and Liver Association from Finland, and Juan Fuertes from the Pulmonary Hypertension Association in Madrid. And then we will go on for a short part that I will talk about from the Swedish perspective before we go over to the second section of the webinar, which is the transplant professionals perspective. And they will share their concerns and their suggestions from how to go forward. And we will talk to Anna Forsberg, our co-chair here today, together with Dr. Pollock from the Erasmus Medical Center in Rotterdam, Netherlands. And we will have Giuseppe Filteri from the Veneto Transplant Center in Italy, and Emma Maatje from the Erasmus Medical Center, also from Rotterdam in Netherlands. And we're very, very much looking forward to this evening. And with that, Anna, could you please introduce Fiona a little bit further?
Yes, but I think that perhaps we would like to know a little bit about who are listening to this webinar, and we would like to introduce a short poll just to get a short glimpse of who you are. So could you please answer this question? And we would appreciate that. And then I will introduce our first speaker. Yes, and here we can see that the majority is an organ recipient, and also there are several healthcare professionals and also some other people who are interested in this webinar, which we appreciate. And now I will move on to introduce our first speaker, and I'm happy to introduce to you Fiona Loud. She received a kidney in 2006 by living donation, and she is a director of the Kidney Alliance, and she also been working as a policy director of kidney care in UK since 2013. And she will now give the perspective of the kidney recipients. The floor is yours, Fiona.
Thank you, Anna, and hello everybody, and thank you so much to ESOT for asking me to come and speak and give some views from the kidney patient viewpoint. Next slide, please. I have no declaration of interest, and please feel free to share my slides. Next slide, please. So these concerns are partly from me. I am a kidney patient. I spent 5 years on dialysis, and I have had my transplant from my husband 13 years ago. But they're also very much from the patients that we hear from, that we support, and those I asked what their concerns were for this talk this afternoon. So 3 different areas. The first one is the direct COVID-19 issues. There is a lot of fear in our community. There is a lot of anxiety. And this is about the infection itself. This is also about death, because we know that some people will die, and some people are dying of COVID-19. There is also a fear that if we were to get ill, we would not be able to get access to limited healthcare resources. So, for example, in the ITU, would we be able to get a ventilator, and so on and so forth. So those are key things that patients have spoken to us about. The next one is the indirect harms from COVID-19. So this is, while nobody is watching, because we are focusing so very much on COVID itself, that there are routine appointments naturally being cancelled and postponed, but that treatments are being missed, and that because of fewer blood tests, worries about safety going to the hospital itself are holding people back, perhaps from coming forward and saying that they're worried about something, which in a normal time they would be quite happy to pick up the phone or to go to their hospital to get some more information about. So will transplants be lost while people are busy looking the other way? And then thirdly is the impact for people of being shielded, being locked down, being told because they are very vulnerable that they must stay in for however many weeks and months it will go to be. And this has caused confusion because some of the messages haven't been very clear. This has pressed on the mental health of many people. So whether it's the anxiety and the sleeplessness I just talked about, or simply boredom itself, providing challenging behaviour, there has been, we've heard a lot from people in those circumstances. I must say though that this does not affect every patient in the same way. So if you are told to stay in for 3 months, if you live in a house with a garden, or you live in a city block with no garden and no access to the outside safely, then that will affect you quite differently, and that becomes a challenge. And this can and is having impacts on anxious carers and partners, on families and the relationships within, when people have to stay together and aren't allowed to go out and talk to other people. Furthermore, we're seeing quite a burden on people's employment, unemployment coming in, people being asked to stay home on short pay. And then finally, but really importantly, we're hearing a lot about food security and people being scared or not knowing how to get the deliveries of food from supermarkets, or risking their own health to going out and joining queues to get food. And we have heard a lot from many people about that. Next slide, please. So some of the things that are
Could you please make it brief,
professionals-
Fiona, so we move on?
Some of the things our transplant professionals can help us with are active monitoring and treatment. Don't cancel treatments unless necessary. Be clear with us about how to get into hospital and that it's safe to be that way. Give us the health advice so we know how to raise concerns. Do clamp down on fake news, but share good news of where people survive. Work with us and help us after this to get back to some kind of normality, and perhaps vaccination when a vaccine comes in. And finally, if I can go to the last slide, just to conclude, please help us to help ourselves to stay well and safe from both COVID and non-COVID harms. Thank you so much for what you're doing to help.
Thank you, Fiona, for an excellent presentation. And in the interest of time, I will save my questions for you to the Q&A session, and I will hand over to Peter, who will introduce the next speaker.
Yes, thank you, Fiona. And now we're going to hear from Maatje Lefton from Finland, and she's been working 21 years from the Finnish Kidney and Liver Association, and she is herself also a liver recipient. Please, Maatje, share us your views about the liver patients.
Thank you, Peter. Good evening, everybody, and greetings from Finland. As said, I got my liver transplant 21 years ago. I went to working life, and now I'm retired from work since already 7 years. Now I live in quarantine because of my age, and I don't go out, I don't go shopping, I don't meet my grandchildren, and my old mom, she's 93 years old, so I'm quite isolated, but I'm lucky to live in the countryside with my husband and have a garden, and I'm allowed to go out. But what are my main concerns is uncertainty and confusion about where do I get the reliable information targeted to an organ recipient related to COVID-19 virus. And is there a channel for professionals I can contact, and can I have advice and all kind of hints how do I cope with this virus? I would say that confusion and uncertainty are very high level at the moment. Then the next concern is, who is my doctor? It's because of the Finnish healthcare has been under change process already several years, and the basic healthcare and the special healthcare are separated. So the basic healthcare do not know what are the symptoms and the problems when you have eaten immunosuppressive medication for 21 years and what kind of illness it causes. And if you are contacted to the special healthcare, they are not interested as a whole person. They are just interested in my liver. That's sorry to say that, but it's the fact at the moment. And what I would like to have in this confused situation is a holistic approach to a patient, that somebody could take a responsibility for my whole package, so to say. And this is missing at the moment in Finland. It's not nice to say that, but it is my experience, and that causes confusion. And what is my suggestion? My expectations are so that I would like to have more this cooperation, networking between transplant professionals and association organization, also between this basic healthcare and the special healthcare. And I would like to see that tasks are sharing and considering the content and the information to the patient, because it's very important what kind of information the patient are receiving. And then I have some suggestion how to plan and implement this project. Next slide, please. I made this kind of graphic, but it's not so very clear, but this is all I said about the expectation I have is this knowledge and information could be shared, and treatment and patient organizations, professional, basic healthcare and special healthcare should have connections to share information, and they may create some kind of pattern or to do it. And I think that the main word in this whole process is cooperation, and then information sharing for the patients who are scaring and they feel left alone, like I do. I must take care of myself, and it's the main message also.
Thank you, Mario. I think a lot of us patients can relate to that, and I will also share the questions that I have for you for the Q&A session. Please, Anna, introduce our next speaker.
Yes, thank you, and it's a pleasure to introduce Juan Fuertes, who is the advisor for the Pulmonary Hypertension Latin Society since 2013, and he will give the perspective of lung recipients. Please, Juan, the floor is yours.
Thank you very much. Hello, good afternoon, everyone. Good evening for those who are in a later time zone. So please, next slides, next two slides. I have no conflict of interest, and please share the slides if you feel like it, no problem at all. And I would like to cut to the chase directly. Information is the key issue here in Spain, at least, and in most of Latin America as well. In many other countries, it happens too. We have a problem with COVID-19, and it is that it is extremely politically charged. So the information we get, we don't know very well whether we get it on time, whether there is transparency enough, whether the numbers are being used in one way or another just in order to drive people to do something like going to work and not keeping confinement, or keeping them at home for a longer period of time than it is actually needed, and that's harmful for the economy. So in the end, people, general public, and especially those people who are at risk, really do not know what's going on and how to react and how to conduct their lives in the best possible way. So today we say one thing about the face masks, tomorrow we say something else, and we have patients, lung transplant patients, that are so scared of being in contact with the virus, because for them it sounds really like a death, certain death. They isolate themselves even from their partners, their spouses, and they live alone because for them it's better to keep in a very, very safe environment, and that means that the person who is actually the carer is away and they can rely on nobody at home. Next slide, please. So we have these 3 points that we identified when speaking with lung transplant patients, and is the need for reliable information. In principle, we must believe that the information that we are getting from the government is correct, but still, I mean, that depends on the country you live in, on the trust you place on your government, and we all know that there are some very, very bad examples of governments in terms of giving information, you know. So there was a moment we didn't know whether it was better to wash our lungs with hand soap, shower gel, or laundry detergent, for example. So there is also the matter in Latin America, for example, where all the resources are going to COVID, and then all the other diseases are being left alone. And I see Anna on the screen. That means I'm running late. Sorry. So it is very important that to have a person of reference, to have your professional, your healthcare professional, the one who's taking care of you on a regular basis to give you the information. And then rely on them and be aware that it is what is green today, tomorrow could be purple with pink dots. Also, safety when hospitalized is not only a matter of safety itself, is a matter of the perception of safetiness. The state of mind, the mind frame influences very much the outcome and the chances of survival. So being well isolated is a key element for lung transplant patients. And the safety at home, as I was talking before, there has one more element, which is the tests for the carers, so that patients can rejoin their loved ones and rely on someone else. Next and last slide, please. So the reliability of the information, we know that our doctors and our persons of reference must adapt their message to us according to our personality, our expectations, our fears, and we count on them to give that information in the best possible way. So keeping the balance is the key issue. Thank you very much.
Thank you, Juan, for a great presentation. And I will leave the word to Peter, who is one of the greatest advocates in our country, in Sweden, regarding organ donation and organ transplantation, and he will present his perspective on organ donation. The floor is yours, Peter.
Yes, thank you. Also, feel free to share. I have no disclosure for this presentation. The main concerns that I found in Sweden is, and I'm not sure if you're aware of that, but in Sweden we've had a lot of responsibility placed on the individual or the patient itself, as we have no severe lockdowns. That means that it's up to us to interpret what we should do or how we should isolate ourselves, what degree we should do. It's not mandated by the government or by our doctors. So it leaves us with a lot of uncertainties, maybe extra uncertainties in uncertain level, because we have, of course, found out that NHS are doing some recommendations in regards to organ recipients. The CDC in the US are doing harsh and strict recommendations on isolation and shielding, even perhaps, whereas in Sweden it's been, well, as an organ recipient, it might not necessarily be a risk group, but you should be careful, has been kind of the message that we have thought. So we've been very unsure of what to do, actually. But the other question I think that also Fiona touched upon earlier also, like, would we actually survive COVID-19, is of course related to how much is the risk of receiving this disease. And there is still a lot of lack of knowledge, as Juan was talking about, mixed reports even with statistically small numbers that you can't really draw big conclusions from. And then there's always this balance of should I be more afraid of the actual disease and what happens in that, or should I be more afraid of the treatment at the ICU or in the ventilator? And as an organ recipient, will I even be prioritized to receive ICU and the best care possible? So those are the issues that we've been handling here in Sweden. And of course, the other issue that's also been hard to ignore is the reduced capacity to transplant. In Sweden, we've stopped all elective transplantations, which means all the living donation. It's only now essential and life-saving transplants, which basically means livers and lungs. We continue with, but we've reduced the others. And then, of course, how to deal with the aftermath, because the waiting lists are increasing. And also, what will happen to all these positive people who has had COVID-19? Will they become an organ donor in the future? Next slide. And what we talked about these things, I'll do that really quickly. We need proactive and clear communications together with the patient community to be able to deal with this. And we also need a transparent strategy for decreasing the mortality, both now and in the future. And in order to be able to do that, I think we need to have an open discussion with the patient community on how to best organize, because I think in Sweden, we've had a lot of discussions. How should we reorganize our healthcare structure to be able to deal with this? Should we nationalize part of it? Should we do it regionally? And that is a very interesting discussion that's going to happen sooner or later. And then the next slide is more of a philosophical kind of conclusion or reflection, if you will. And we're really stress testing our whole system. And I think I'm just wishing or hoping for even that what will come out of this is that the patient community and the professional community will become closer and more united in our fight against this, and to be better at organ donation after this. Thank you, Anna.
Thank you, Peter, for a very nice presentation. And we have rapidly reached half time in this webinar, and now we will move on to the next part, which is the perspective of the transplant professionals. And I'm happy to introduce Giuseppe Filteri from the Benito Transplant Center, who is trained in cardiac surgery, and he will present the perspective of the transplant coordinator. Please, Giuseppe, this floor is yours.
Thank you, Anna. Good evening, everybody. So just to show you what my idea is, I will show the perspective of a person in charge here in my region to support organ donation. Veneto region is on the northeastern side of Italy. It's very well known for Venice, Venezia, but more recently is known for being the fourth region in terms of infected and diseased patients because of COVID. Next slide. I have no disclosures. Next slides, please. Okay. This graph is my greatest concern because I could see this graph nightly and daily and continuously updated on the left of my computer. And here I show you the total number of patients that we admitted in our ICUs because of COVID. And I would like you to point out the dramatic increase that we had until the end of March, where you can see an average of almost 35 patients entering the ICUs every day. Consider that by this rate of numbers, we reached almost 85% of the occupation of the total beds on ICUs that we have. So my concern was, will this impact on organ donation? Also taking into account that we were noticing in that period that there was a tremendous decrease in the number of patients affected by cerebrovascular disease who were admitted to our emergency room. And this observation was common not only to us, but to the rest of Italy and to what I can understand to many other countries in Europe and in the world. The answer to this question is yes. Next slide. We had an impact on organ donation. This is our national trend on organ donors. And as you can see, after the red arrow, which is about the 20th of February, the first case in Italy, which came just in Veneto of COVID, we have a dramatic reduction in the number of potential donors that we were able to evaluate. But this slide brings you a second message, which is a message of hope. And you can see that after 3-4 weeks, we were able to recover. And even though COVID has not finished here, we were able to overwhelm the situation, and now transplantations are increasing. Next slide. So I got, as a professional, a transplant coordinator, I got 3 messages for you. The first message is that even though we are in a COVID era, donation is feasible. That even if we are in a COVID era, transplantation is feasible. And the third message is that both can be performed safely by tools of different strategies. Some of these are listed in these pages. I want to also make you notice that here in Veneto, due also to great work or organization, we were able to restart kidney donation from living donors. Last slide. My message to Donors Association: keep promoting donation, especially in this period. To Recipient Association, favor education. On the right side of my slide, you see this nice poster, which was prepared by the joint action of the 3 major Italian association of kidney, heart, and liver recipient. Improve self-empowerment. It's critical in this period. We need, as many others said, mutual trust with our transplant doctors, and you all need to keep our compliance. And then to the association, please support your associates, because they all need support for everything, also for bringing the drugs, the immunosuppressant drugs at the hospital, also for getting the renovation of the driving license, so also to know what to do in their workplaces. So my final message is, here in Veneto and here in Italy, we still have COVID, but we were somewhat able to get through. If we work together, we can do it. Thank you.
Thank you, Giuseppe. And I really appreciate the fact that even if you have had a very distressing situation in Italy, you can still bring so much hope into this discussion. And I leave the word to Peter, who will introduce the next speaker.
Yes, thank you. And our next speaker is Dr. Pollock, and he's working from the Erasmus Medical Center in Rotterdam. And he is, amongst other things, the chair of ELITA, which is the European Liver and Intestine Transplant Association. And he will share with us the surgeon's perspective on this. The floor is yours, Dr. Pollock.
Thank you, Peter, for this kind introduction. Thank you, ESOT, for invitation for this amazing and very interesting topic, uncertainty with regard to COVID in solid organ transplantation. So I was asked to give the point of view of the surgeon, of the transplant surgeon, what are my concerns regarding COVID-19. So what just Giuseppe mentioned, I think that we are all very concerned about the impact of the COVID-19 on donation rate. As you saw, from presentation from Giuseppe, there's a decrease in donation rate all over the Europe. Some countries are spared, but in most of the countries, and I will show you in the next slide, donation rate dropped rapidly. And it is not only for disease donation, but it's also for a living donation. As you heard, many centers, or most of the centers, stopped their living donor transplantation. We in Rotterdam stopped both living kidney and living liver transplantation. So that has an impact also on the waiting list. And we don't see it now, but we will see it probably in a few weeks or months, that there will be increased mortality on the waiting list, and also increasing dropouts from the waiting list, patients who are not able to be transplanted on time. Of course, another concern is organ recipient safety around transplantation procedures. So we now test all our organ recipients for COVID-19, just to be sure that we don't transplant them in the period of infection. But also in the perioperative period and post-transplant period, we have to protect our recipients from the COVID-19 infection. Another point is what has been mentioned by Fiona, by Mario, that the patients who are on the long-term follow-up, they need to be also protected from this infection. But also what we've heard, they need to be followed up. So they need regular checks, regular visits in the outpatient clinic. And we have to provide protection from the infection when they visit the clinics. Right now, we do many consults by phone, but of course, we need to see the patient as well. And they, as we heard, they need to be seen. Next slide, please. I didn't mention, but also just going back to the previous slide, what I would mention is the safety of the transplant team and safety of the donation team, because these teams, especially donation team, are going out to procure the organs, and of course they have to be also protected from the infection. On this slide, you see what you saw also from my previous speaker, the donation rate in Spain, which is of course leading country in donation, how the COVID-19 affected donation rate and transplantation rate. It dropped rapidly from around 17 transplants per day in Spain to 2 transplants per day. The country, like the Netherlands, it's a country of the middle donation rate, and we dropped from a number of transplants per month from around between 100 and 150 to below 50. So it's tremendous impact of COVID-19 infection in the transplant world. Next slide, please. And then what we can expect from patients and their organizations, how can they focus on to help us or to work together? And I think it's all about the communication and the communication with national transplant organizations regarding guidelines and recommendations. The problem is that we have a very scarce evidence, and unfortunately, probably you would like to listen from me or get some more information, but we are moving a little bit blindly. We don't have evidence yet, so we are collecting it, but still we don't know many things we should when you ask us about COVID-19. And if we have this recommendation, even if, as you said, sometimes they are contradictory, we should respect and follow the existing recommendation. And I think one of us already mentioned, we should be very careful and responsible when we select the information on the media, and especially on the social media, because sometimes they are very scary, but they are not true. They are really fake. Next slide, please. And this is what we are doing within the LITA. We are trying to collect information from all over the Europe. So this you can find on the ESOT website, on the ESOT Transplant Live. When we update the current situation within the Europe on the COVID infection in liver transplant recipient and liver transplant candidate. And the good news is that at least what we see now, at least the liver transplant candidates are not more affected by COVID-19 than the regular population. So although we think immunosuppression potentially makes prone these patients for infection, even if they get infected, they are not severely ill. Of course, some of them died, and we saw it, but this is within the range of the general population. And we are collecting now the data, detailed data from all infected patients with COVID-19, trying to analyze the impact, but also how we can treat this patient and what are the risk factors for the dismal outcome. Next slide, please.
Dr. Pollock, can I please ask for a short conclusion?
Yeah, that's conclusion. So I think the most important thing is right now to establish evidence-based guidelines and recommendations for transplant community. And this is both for organizations, patients, professionals. Without them, it will be very difficult to move on. And again, collaboration on information exchange between transplant professional and patient organizations is essential. Thank you.
Thank you for your excellent presentation, and I also find it very optimistic hear about that results. And with that, I would like to introduce Anna Forsberg, a dear friend of mine and a professor in the transplant area, and also within high-tech care within the ICU, in the emergency and in the transplant area. And she's also the champion of person-centered care here in Sweden and worldwide. The floor is yours, Anna.
Thank you. And before I give my presentation about uncertainty in illness, I will introduce Emma Massey, who is an associate professor at the Erasmus University in Rotterdam, and she is a psychologist, and she will present the perspective on from the psychologist. The floor is yours, Emma.
Thank you, and thank you for the invitation to participate in this webinar. I will give the psychologist's perspective. I don't have any conflicts of interest, and feel free to share my message on social media or otherwise. So I was asked to describe what's my main concern during this corona epidemic or COVID-19 within the transplant community from my perspective as a psychologist. And my main concern is the impact on mental health. So the dominant dialogue at the moment in the news, in the newspaper, we also heard these words used in this webinar, are things like fear, confusion, uncertainty, anxiety, and even anger and sadness at the loss of certain things. So these are things that are affecting all of us in the general population, but there are also extra concerns for the transplant community, for transplant recipients. So things like concerns about rejection of the organ, things about concerns about catching corona and what would happen if you needed access to healthcare, and the limited contact with transplant professionals. So, and on a daily basis, we're confronted with the numbers of deaths due to corona, and at the same time we're in lockdown and we're maybe alone at home with lots of time to think, and this can lead to ruminating, excessive worry and catastrophizing, and these are factors that can lead to increased mental health problems. A lot of people, a lot of the panelists and presentations have talked about misinformation on social media and on the internet, so I won't talk too much about that, but this is also a factor that can increase anxiety. And at the same time, we're also socially isolated, and this means that we can't be as much in contact with those who would offer us social support to try and alleviate our fears. This is one of the most important coping strategies when it comes to mental health, is social support, and we're limited in that right now, alongside things like our disrupted daily routines. And one of the risk factors for poorer mental health or increased mental health issues is, on the one hand, feelings of loneliness or isolation, but for those who are with their families 24/7, that could lead to increased tension or increased distress in the home, and not everybody has a safe home environment. So these are all factors that could lead to more mental health issues during this pandemic. And a very related issue is lifestyle. We know the importance of lifestyle once you've had a transplant. So we're all stuck indoors. We can't go outside and enjoy the nature. If anybody's using a pedometer, they will know we're not taking as many steps, we're not moving as much. Our eating patterns may be influenced, and certainly increased worries about uncertainties can also disrupt our sleep patterns. So these are all factors that could, there's no evidence for it because we don't have that yet, but these could negatively impact mental health. Next slide, please. So I was also asked to describe what I think that patient organizations and patients themselves can do to alleviate this. It's been mentioned a number of times, but patient associations could really help by really signposting the best information, the most reliable sources of information for transplant recipients, as well as information generally, but also particularly information on how to seek help if you are experiencing increased anxiety or mental health issues. For example, regional or national telephone helplines. This could be one way of signposting help when you need it and how to get it. For patients themselves, there are lots of things that I could have put here. Coping strategies to help reduce anxieties. So staying in touch, trying to obtain social support even though it's at a distance. So I just want to focus on the last 3 just to highlight them. If you feel like you're having increased anxiety, some methods that we really know do work are, for example, writing down your thoughts. Don't write them down as facts, they are thoughts. It can help you work through them. Try and find a moment at the end of the day or during the day of peace and quiet and think about, there's always a silver lining to most situations. Try to count your blessings. This helps us focus, shift the focus from the negative to the positive. And finally, if you feel your anxiety or your stress levels rising, try to look up some deep breathing exercises or relaxation techniques. For example, gradual relaxation from your feet right the way up to the top of your head. We know that these things really do work also to help you sleep. So my take-home message is stay positive, stay connected, try to find some balance and stay safe.
Thank you, Anna. This was a perfect introduction to my presentation regarding uncertainty, and I also wish to say that we really appreciate your advice regarding self-care, because I think that's of utmost importance at the moment. And I will move quickly to my presentation regarding uncertainty in illness, and I have no conflicts, and you can share my pictures. And this is just a short a presentation based on the theory of uncertainty in illness developed by Michel. And the meaning of uncertainty is the inability to determine the meaning of illness-related events and accurately anticipate or predict health outcomes. And I believe that's the actual concern at the moment with the COVID-19 pandemic. It is ambiguous, it's inconsistent, and it is a very complex situation. Next slide, please. Uncertainty results when a cognitive schema for the illness cannot be formed. And since COVID-19 is a completely new situation for all of us, it is difficult to form this cognitive picture. And there are 4 forms of uncertainty, and it's as we all know now, because the presentations before me has revealed that ambiguity exists concerning the state of illness. Next. And it's also a complexity regarding system of care and treatment, because there is an overload of the hospitals, and we don't know when there will be a treatment or if there will be a treatment. There's also a lack of information, as we have learned, about the diagnosis and the seriousness of illness. Next, please. And it's also unpredictability of the course of the disease and the prognosis for especially transplant recipients. Next, please. So what are the choices and opportunities? Well, uncertainty can be appraised either as a danger or as an opportunity. And actually, we can make a choice here. If we view uncertainty as an opportunity, it requires preoccupation with the positive rather than the negative, as advised by Professor Maatje. And uncertainty actually also might facilitate some hope. Next, please. Strategies to deal with uncertainty. Well, one strategy could be avoidance, but that's not the strategy I recommend in relation to COVID-19, because we really have to face the reality regarding this pandemic. What we could do is to be selective ignoring, which means that we don't have to read every tabloid or listen to every news program regarding COVID in order to neutralize the threatening content. It's also important, as suggested by Professor Maatje, to reordering our priorities, and actually it might be a good opportunity to make changes in lifestyle, and also to focus on the positive aspects of unpredictability. Next slide, please. So take-home message from me is it is completely reasonable to be uncertain in relation to this pandemic. It's important to rely on the information from the transplant professionals, since it hopefully reduces the uncertainty. And the things that we all can actually control by ourselves is how we follow the recommendations, and also to have faith and try to focus on the positive aspects of lives. And now I hand over to Peter, who will introduce the Q&A session.
Yes, we are so eager to hear from you. We have a little bit over 200 attendees today in the webinar, and we would love to hear from you. And there are two ways for you to be able to ask your questions. One is to raise your hand, as you can see here, number one. And then the moderator will call your name and unmute your microphone. The other way of doing that, asking a question that is to be able to type your question directly into the chat function, and then we will direct it to the person that you are wanting to ask the question. So please be clear about who you want to answer your question, and we will try to help you out with that. So fire away, friends.
Okay, so we already have a lot of questions in the chat box. I will start from the first. Is there any knowledge about the use of everolimus and tacrolimus in concern to COVID-19? I think this is a question for one of our medical professionals. There's no indication about the specific speaker, but I see that Wojtek is already there.
Well, we don't have any data on this. Unfortunately, as I said, we are missing a lot of evidence. It's something new, and we cannot say. In fact, there were a lot of discussions. Shall we reduce the immunosuppression in the COVID-infected patients? But as I said, there's no evidence for this, and also no evidence that one of the immunosuppressant is better than the other. So the use of everolimus, I don't have any data. I just looked up the PubMed today. There are like 30 publications on COVID-19 in the liver, in the solid organ transplant setting. No information. I cannot answer this question, unfortunately.
Okay, thank you, Wojtek. This is something new and we are learning every day. So I'll give now the ability to ask a question to Jürgen Haraldsson, who raised his hand. So I am unmuting him. Jürgen, are you on the line?
Yes, can you hear me?
Yes.
Yeah, I have a question. Is there any risk of or lack of supply for immune suppressive medicine worldwide, or worldwide?
Okay, is there a particular speaker you would like to ask this question to?
Perhaps it's Wojtek again.
Okay, thank you.
Well, it's difficult again to answer this question. I don't expect this. I think the pharma companies are still producing medication, so I don't expect that we will run out of the immunosuppressants.
That's wonderful news.
Perfect.
Thank you, Wojtek, and thank you, Jürgen. Sorry, Giuseppe, you wanted to add something?
Yeah, as far as I know, I don't have any news about lack of drug supply.
Thank you.
Great.
So the next question on our chat is by Sherry Burry, who's asking if we should recommend patients to stay home from work after quarantine, or if we should suggest to follow what the national decrees and guidelines are suggesting. Again, I have no indication for the speaker specifically, so we'll take this on a voluntary basis.
Well, maybe I can try to give an answer, and I think it's important to follow the national recommendations. There are no evidence actually that it's useful to stay home from work, and there are different recommendations in different countries. As Peter mentioned before, it's in Sweden it's quite liberal. It's up to everyone to actually take care and follow the recommendations. So that's my comment. Follow the recommendations in your own country. It seems like Giuseppe also can add some information regarding this.
We are losing the connection with Giuseppe. Maybe Dr. Pollock can answer.
Yeah, I think that's a good point. What you said. I think we should follow the existing recommendation. Of course, they can be changed within a certain period of time, but right now, what is recommended by transplant professionals, by this association, as I said, they are not really evidence-based, but they are mostly experts' opinions, but we have to follow them. That's my advice.
Okay, thank you so much, Wojtek. And I would now like to unmute Gabriela Smira, who also raised her hand. Gabriela, are you on the line?
I'm on the line, but I don't have any question. It was the same with I hear before. It's okay.
Okay, thank you so much.
Thank you.
Okay, then the next question is by Jayapala Reddy, and the question is whether organ recipients are more at risk of becoming carriers. Again, no indication for the speaker specifically.
Again, I think I have to answer the question. Although, again, it's difficult. It's more speculation. You mean carriers at not in more prone for infection, but just carrying the virus as a chronic carriers? I think there is no information about this. I'm not aware of this.
Okay, thank you, Giuseppe. You wanted to.
What we saw in our ELITAR survey and also collection from data, that luckily the transplant recipients are not more prone for infection. So I guess they are not also more prone to be chronic carriers of this virus. But it's only speculation.
Thank you. Giuseppe?
Yeah, we are carrying on a survey on our transplant recipients in Italy, so nationwide. And what I can tell you is that, of course, there is seems to be an increased risk for transplant recipients to get infected. But when the infection is started, there doesn't seem to be such a big difference in the behavior than what happens in non-immunosuppressed patients. We are still working on that, but we have not such a huge difference. Okay, of course, in some patients it can be more aggressive, but the course of the disease seems to be quite the same of a non-immunosuppressed patient. But we will tell you more once we are ready with our data.
Yeah, thank you. And I will hand over to Peter, who will now introduce the final poll before we summarize this webinar.
Yes. Before we summarize, we just want to give you, everybody listening in, the chance to give your feedback on what you thought. So could you please put on the poll? Is that possible, Luca? Or maybe the poll is not working as right now. Here. Overall, what do you think about this webinar? How helpful was this to you? And you could select one of the following: extremely helpful, very helpful, somewhat helpful, not very helpful, or not at all helpful. And we're doing this so we can get your feedback, of course. As you said, we are in the middle of this uncertain period, and as I think it was Professor Anna who talked about, you could either respond to this either by looking at it as a danger or as an opportunity in making these changes. And we thought that this webinar was a way of at least addressing this uncertainty in this very extreme situation that we are in. And we don't know what you thought about it, but we're of course hopeful that you enjoyed it. We've also said that the questions that we did not have the time to handle, we will try to handle afterwards. And we will also provide a link to this webinar, so for those who couldn't see it live, will be able to see it later. And I would also like to thank all the panelists, but also all the participants for joining us here today. And I think that should be it. Anna, would you like to add a concluding remark?
I just would like to remind that in the handout session, you can find a link to a survey that is ongoing, and it's also a part of this project where we try to create a platform to work together, patients and professionals. So I just wanted to encourage you to answer the survey. And I'm so grateful for you participating and listening to this webinar, and for all the attendees. So take care and have a nice evening. Bye-bye.